have an understanding of your specific sleep study results and understand why CPAP will benefit you, we'll talk more specifically about the CPAP equipment, including the components, power supply, the tubing, the mask, and the variety of different mask interfaces that are available. We're going to talk now with Angie Grant, who is a respiratory therapist here at Memorial Home Services. She's set up hundreds of patients on CPAP therapy and helped countless others with questions with their therapy and their components and machinery. Angie, can you tell me a little bit about what comes with a setup, the machinery and the pieces of equipment that they get?
Sure. We have several different kinds of machines, but this is what we have right now as far as the biggest and best, I guess. And we have a CPAP unit here, and this one is integrated with a humidifier, so the humidifier is actually part of it. Some of them are separate. And then you'll see a humidifier chamber, and that'll just go into the side here. We'll be filling that with distilled water. You'll have a tube that connects to the back. We'll talk more about that later. And then at some point we'll pick out whatever mask best suits the patient.
So are there different types of masks for different types of face shapes?
Oh yeah, everyone's different, and just because a mask fits your neighbor doesn't necessarily mean that it's going to be good for you. Some people are much more comfortable with a mask that covers their nose and mouth. Some people are more comfortable with a mask that just covers their nose, and then they have nasal pillows, they're called, that just kind of fit inside of the nares.
Okay. Mask fit can be tricky for some people, where they switch back and forth. Do they try one mask and it works, and then sometime or doesn't work, and then they try something else?
Yeah, you know, if you find one that works well, it's really great to stick with it. But in the beginning, you're always hoping that there's something a little better. It's really a lot of getting used to the mask. So we'll find something that we feel is best, and we'll ask that a patient would try it for a week or so, and then if they're really struggling, we ask that they come back in.
Okay. And how is the CPAP pressure determined?
Well, part of that, most of that is sleep study. Sometimes they don't get to an optimal pressure during the sleep study, but in the sleep study, the tech that's doing that is adjusting pressures constantly and watching numbers.
To see what works best?
Yeah, to see what your body responds to. And everyone's different. It's all about the anatomy of your airway. So sometimes it's going to take more pressure and sometimes less. And they give us an idea of what's best. We have a way of monitoring that, and sometimes things will change a little bit afterwards.
Okay. And the higher the pressure, is it more difficult for the mask to fit? Is that when you run into mask fit problems?
Right. That's a good question. When you have more pressure, it's more difficult to maintain a seal. So that's what it's all about, is trying to find that good fit. We want to try to make you comfortable, but if you're on high pressures, then we're going to have to get your mask tighter in order to maintain a seal. It kind of blows the mask off. We have to keep the seal.
Okay. We do have a patient here today. His name is John. He's going to be set up on CPAP right along with you. So you'll be able to follow along with him and see the components that you'll be set up on.
We're going to kind of focus on the machine here for a minute. This is the CPAP portion of things, and this is the humidifier chamber. I want to look at the back of the machine first so you can kind of see what I'm seeing. So this is the where you're going to plug in the tubing. And your tubing has a place that you're going to need to find where you've left it and plug it in. So this is going to plug in like this, and then that's somewhat adjustable. You can move it from side to side. This is where your power comes in. On the side here is where you're going to see the filter. This needs to be maintained, so you're going to pull the cover out, and this gets the dust kind of flicked out of it once a week. You're going to place this back here, and then the other thing I wanted to show you is this has an internal memory, but there's also an SD card that we can get information out of. It says SD right here, and if you needed that for a doctor's office visit, you would just pop that out and take it with you. The front of the machine here This is the power button, and really this machine is designed to just turn it on and turn it off. It kind of does everything for you. This machine will adjust your humidity based on your room humidity and what the temperature is outside. You'll notice that some days you use more water than others, and that's appropriate. It all depends on your mask fit and the weather and how dry your house is, and these things all change. This gives you some information if you were interested. You can look into different pieces of this and see things. This is telling me that we only have put this on someone for 1 minute and the mask seal was excellent and the humidifier was working fine. There's a home screen button. This is something that you'll be paying attention to. We're going to talk a little bit about the mask now. We're going to try a mask on you, John, and see how you feel about this. John and I have discussed this, and we feel that it's best for John to have a full face mask, and this is what we've chosen based on his face shape and the way that things work for him. So John, we're going to put this on, and then we're going to give you your pressure, and at that point we're going to have you take it off and put it back on yourself, okay? This is meant to fit at the bridge of your nose and right under your lip, okay? So let's go ahead and have you place it where it feels comfortable, and then we're going to go ahead and put the headgear on, and what we're going to do is adjust this and then have you adjust it if it's not right, okay? So there we go. The Velcro, does that feel okay? Okay. Now we're going to start with this, and if there's a problem, we're going to have to adjust it to make sure. Once you get a leak, it's going to compensate for leaks and be more uncomfortable. So having it the right tightness is key to comfort. Okay. So here comes your pressure. And what we're doing now is we're going to check to see if you've got any leaking. Are you feeling any leaking in your eyes? We don't want any air in your eyes, and I don't want to feel any air down here. We will feel air around this mask. It's built in to have some leaking around it. It's supposed to, okay? So let's have you take this off. There's a couple of loops here that we want you to just use that, not the Velcro. And I'm going to turn your machine off, and then we'll have you pull that off and kind of look at how it's put together and how you're going to loop it back together, and then we want you to just put it on yourself and get comfortable with this. Good. Go ahead and turn your machine on and see if we've got a good seal.